All right, welcome back to the Coach's Corner Show, brought to you by Beggar's Pizza. I'd like to thank Desi Villon for being our guest. Sandburg Girls Soccer going to be another state powerhouse this season. Now we've got on Tom Mulvey, owner of Athletics. Tom, thanks for coming on board once again, buddy.
Thanks for having me, Pat.
Appreciate it. All right, you know, this concussion situation, whether it's in professional sports or it's in youth sports, it's really taken over things, Tom. You're an expert on this situation. Whiplashes, head injuries. What's the deal with this? What's going on here?
I wouldn't say I'm an expert, but I do see these athletes in varying degrees of injury. There was a study done between 2001 and 2005, and there are very few studies done, but this one in particular showed 500,000 young athletes between the ages of 8 and 19 being treated for, traumatic injuries of the head or possible post-concussionary symptoms.
Wow.
And approximately half of those kids that were treated were sports-related. And the other interesting thing is 40% of that half were between the ages of 8 and 13. And, you have your most common sports of, say, hockey or football leading the way.
Yep.
But what they find now is, interestingly, is more and more girls are coming into the issue of having these problems. And if they take any particular sport in which girls and boys play together, girls by far have more concussionary injuries. And, they really don't know why. They do know that these girls are aggressive and that they do, play just as hard as the boys do. But we also believe that there are some ligamentous issues and some structural issues, like more weakness of their neck muscles, that lead them to being more susceptible.
Yep. So what's the mechanism of the injury then, Tom?
You take, this is the back of the skull,
Yep.
and you have very, very small, strong muscles that work to support the back of the skull here. But the head itself can take a trauma, and you can have either a direct injury, which is obviously how it's said that the blow to itself affects the brain and results in the trauma. But you can also have a shaking type injury.
Yep.
I've seen soccer players hit the ground, no one hits them, just the shaking brings on these symptoms. You also, though, and it's important to comment about, you have on the back of these muscles of the neck, you have arterial supply that goes up into the brain that goes through those muscles. And a lot of times the injury is either a neck injury or a combination of neck and the concussionary injury to the head. And that arterial supply that's there and the muscles that go around them are a large cause of some of the discomfort and headache type pain.
Okay, and that leads me to this, Tom. I mean, a lot of people, as soon as they get a headache or if they have a little bit of pain in their neck right away, people are thinking it's a concussion. That's not specifically the case, though, right?
Typically they divide it into 3 sets of symptoms. There's physical symptoms, which
Yep.
are the more common: the headache, nausea, dizziness, fatigue, difficulty sleeping, those types of things. Then you have cognitive symptoms, and those are more just difficulty with being able to attend to task, some amnesia, short-term, long-term, difficulty thinking about things. And then the final one is more emotional. You have, where you might be irritable, depressed, those types of things. Those things tend to steer you towards it being more cognitive and being more of a head-related injury. You also have neurologic factors that can occur. When it's more of the headache, and actually you can feel and examine the neck itself, and you find that those areas are tender, then you address those things, and that's what a physical therapist would do.
Yeah, and people should be aware. I mean, if you do have a head injury or a neck injury, I mean, parents, what should they look out for here? What should they be aware of?
First of all, you really, when there is any kind of trauma, or realize that the athlete wants to play, and they're not going to be honest with you.
Yeah.
They want to get in there, they want to play. So respect that. Also be aware that when they have a head injury, that they can have symptoms of nausea, they can be fatigued, they can have that headache. Anything that lingers for about 12 hours needs to be seen by a neurologic specialist to make sure that is not an issue. And the proper treatment needs to set in then. And the only other thing I would say is make sure that the person that examines the athlete also examines the neck.
Yep. And what's the role of a physical therapist?
It's the balance issue we would address,
Yep.
and most importantly is examining the neck. Unfortunately, we will get young athletes that are treated as if it was a cognitive head injury, and they're out of commission for a few weeks on end, still having the same headache type symptoms. They might try medication, and all of a sudden they come to us and they have neck pain.
Okay.
You know, if we can get those athletes earlier, we can alleviate a lot of the symptoms and make them more comfortable.
Is there anything parents can do to help their children, prevent these type of injuries, or what?
Absolutely. You know what? Get involved. When you think of, when you think of sports like, for instance, soccer, be sure that all protective equipment is used. Go to practices. Make sure the practices are being done properly and proper techniques for doing headers are used. It's amazing. You know, a header is a pretty complicated little skill, and girls get very good at it. But trapping with their foot instead is really a more appropriate skill to use. The header's easier for them to do.
Right.
And they'll do more of them. It's convenient, and they'll do 6, 7, 8 in a game. And it's using it properly is probably the number one thing.
That's the big thing.
But get involved, go to practice, see what's being done, and be comfortable with techniques being taught.
And that's the key with anything, man.
Yes.
You get involved, and you know what's going on. Educate yourself a little bit.
Absolutely.
And things generally take care of themselves, right?
Absolutely.
All right. Well, Tom, once again, thanks for coming on board here.
Thanks for having me.
It's always good to have you on here, man. Very informative. I mean, and people, when we have you on, they always respond to it because, you provide them with a lot of information, good information here, man.
Good to be here.
You know what? All right.
Good to be part of it.
All right, folks. Now, remember, we're going to go to an athletics timeout, all right? And when we come back, we got the big Isaac text poll question of the week, sponsored by Standard Bank. And you Sandberg soccer people are going to definitely want to hear the Isaac text poll question. It's going to be soccer related, okay? So when we come back, we'll hit on that, a couple players of the week. Stay tuned.
Having surgery or dealing with some type of nagging pain that limits your function? Then get to Athletics. We offer treatment for all types of orthopedic injuries, work-related injuries, and sports injuries. Therapists with over 20 years of experience provide treatment that is efficient and effective. Our 2,000 square foot clinics offer state-of-the-art equipment from HydroTrack, Blankenship, and Biodex. If your doctor suggests physical therapy, then you suggest Athletics, where every patient is treated like a champion.